Today we're going to look at sickle cell disease, and we're going to start with the definition. We're going to talk about the causes, the types, and the pathophysiology, as well as describe the crisis that a sickle cell patient is likely to be going through. The sickle cell disease is an umbrella term for a group of inherited hemoglobinopathies in which abnormal sickle hemoglobin S partially or completely replaces normal adult hemoglobin. So there are different types of hemoglobin, and there is this abnormal hemoglobin, which is known as hemoglobin S, which replaces the normal hemoglobin A in a person who does not have sickle cell. And we have two common sickle cell types, and these are the trait and the disease itself, the sickle cell anemia. So before we go into the types, let's look at the types of hemoglobin. First of all, we have hemoglobin A, which is the normal adult hemoglobin, and about 97% of adults have this hemoglobin A. It is composed of 2 alpha chains and 2 beta chains. On all these chains are made up of several they are made up of polypeptide chains. And these polypeptide means a lot of amino acids are there making up these chains. So in hemoglobin A, we have two alpha and 2 beta chains. Then there is hemoglobin A2. This one is made up of 2 alpha chains and 2 delta chains, and comprises of about 2% of the adult population. About 2% of the adult population has hemoglobin A2. And then there is hemoglobin F, which is the fetal hemoglobin, which is made up of 2 alpha chains and 2 gamma chains. So you find that this baby will have this type of hemoglobin from about the 3rd month, or from about the time of birth to about the 9th month of this baby. So this structure is just showing us the hemoglobin structure inside of a red blood cell. These are the chains that we were talking about. We have this one alpha chain and another alpha chain. We have one beta chain and another beta chain. So this is the normal hemoglobin A for an adult. On each chain, you are going to find a heme group and an ion molecule on that heme group. On each chain, there's going to be a heme group and an ion molecule. So sickle cell disease can also be defined as a congenital hemolytic disease that results from a defective hemoglobin molecule that causes red blood cells to become sickled, and this results in recurrent sickle cell crisis. Okay, so you find that this person who is a sickler is going to be going into crisis. Okay, these are very severe, painful episodes of sickle cell crisis. Now, hemoglobin S results from substitution of the amino acid glutamic acid, with the amino acid valine on the B globin of hemoglobin. So if you look at this chain, there are a number of amino acids on this chain. Some of them are not showing, but we find that on the sixth position, where there is supposed to be glutamic acid, there are several different types of amino acids on this chain. So on this 6th position, where there is supposed to be, in a normal human being, there's supposed to be glutamic acid. On this 6th position, you find that in hemoglobin S, this glutamic acid is replaced by the amino acid valine. So this replacement leads to abnormal hemoglobin. This abnormal hemoglobin is known as abnormal hemoglobin S, which will result in the cells being starting to sickle. So you find that a patient who has sickle cell disease will have cells that will be sickling. Now there are different types of sickle cell, but we're going to discuss two in general. There's sickle cell trait. Now, this is the heterozygous form of the disease. This is where the person inherits only a trait from one parent. So the disease is heterozygous, and this patient will not exhibit any signs and symptoms. Then there is sickle cell disease itself, also known as sickle cell anemia, and this one has a homozygous inheritance of the sickle cell trait. So they have an inheritance from the father and an inheritance from the mother, and this results in the patient having sickle cell disease. This is a diagram showing us a pictorial representation of the sickle cell trait and disease, how somebody will end up having a disease. If two people who both have a trait get married, you find that they will have a 25% of having a child with sickle cell disease, because you find that the sickle cell, the hemoglobin S is on on a chromosome of the father and on a chromosome of the mother, and so you find that one of the children is going to end up having sickle cell disease. On the other hand, the father and the mother, if a child inherits a normal HB from the father and the SHB from the mother, they will end up having the trait. So this child here has the trait, and this child here has the trait, and this child will end up being a normal child without either the trait or the disease. So you find that they will inherit the normal hemoglobin A from the father, the normal hemoglobin A from the mother, and they'll end up being normal. So 50% of the children of these two are going to have the sickle cell trait, and these are also known as carriers. And then 25% are going to be normal without the trait nor the disease, and 25% are likely to have the disease. The pathophysiology of sickle cell disease. Now, when the patient who has HBS is exposed to low oxygen tension can be as a result of anything ranging from exercise to diseases such as those diseases that will lead to dehydration, for example, diarrhea, or diseases such as malaria that will lead to the patient having low red blood cell count. You find that these molecules inside the cell, inside the red blood cell, are going to be insoluble. They're insoluble and they're going to polymerize. They're going to crumple together. The flexibility of the cells is therefore decreased and they become rigid and they take up their characteristic sickle shape. Okay? So this process is initially reversible. Once the patient goes out of the place where there is low oxygen tension, they go where there is high oxygen tension, or the patient is given oxygen. Define that the process is reversible and the cells go back to normal. They go back to being disc-shaped. However, when this continues happening for a long time, you find that this process is no longer reversible and the cells will continue being in the sickle shape. Now, these cells that are sickled in nature, so if you look at this diagram here, this picture is showing us a blood vessel with normal red blood cells that have this disc shape. And this other one is showing us the blood vessel with red blood cells that are mixed. Some of them are sickled, some of them have the nice disc shape. Now, the sickling of these cells will result in shortened red cell survival. These red cells that are sickled will not survive much longer. The normal lifespan of a red blood cell is supposed to be about 120 days. However, you find that in a patient who has sickle cell anemia and these cells are sickled, they're going to have a shortened lifespan. The second thing that will happen is that they're going to impair the passage of themselves as the cells and other red blood cells in very small blood vessels. And so you find that once there is occlusion of these blood vessels, there isn't going to be blood going to the peripheral organs. Whatever organ that is supposed to be provided by this blood vessel will be blocked of the blood supply. And so you find that that organ is going to be in hypoxia. Now, the resulting hemostasis promotes a self-perpetuating cycle of local hypoxia. So we're saying that there is going to be hemostasis. You've seen here, there is stasis of blood in this area. Therefore, the distal portion of this blood vessel is not receiving the blood that is supposed to receive. This results in local hypoxia, deoxygenation of the particular organ, okay? And more erythrocytes will start crumpling there and there will be more sickled. The body will also respond by trying to remove these abnormal cells from the circulation. Now, once this body responds, it means that it is going to recognize these red blood cells as abnormal. And so some of these red blood cells are going to be destroyed before the normal time of their destruction happens. So therefore, the red blood cell lifespan is shortened. These cells that are sickled will accumulate in small blood vessels, and so the blood is going to be very viscous. This will lead to impairment in circulation, and therefore the patient is going to be in severe pain. There's going to be infarction in that particular area, and there's going to be swelling. Now remember, this is happening in the whole body. An increase in blood viscosity, circulatory stasis, and the resultant hypoxia will lead to further sickling of the red blood cells. Now, when the occlusion is extensive, there is going to be necrosis, because remember, if this blood vessel is supposed to take blood to a particular organ, but this distal organ is not receiving the blood because there is occlusion in this blood vessel, it means that organ is going to it's going to start necrotizing. There is going to be necrosis, then this is going to result in extreme pain. Then this extreme pain is known as sickle cell crisis. Now, if this process occurs repeatedly, the progressive organ failure and chronic hemolysis will happen. So this patient will end up having multiple organ failure. Organs that may fail include organs like the kidneys, even the brain may be affected. And so you find that this patient may eventually die. Okay, so that is the pathophysiology. Now, there are several crises. There are several types of crisis. We have already talked about what a crisis is. This is when there is multiple organs that have been involved. There is severe and extensive necrosis or infarction in those organs, and so you find that the patient is in severe pain. Now, there are 4 types depending on the cause of this crisis. The first one is hemolytic crisis, then we have thromboembolic crisis, which is also known as VASO-OCCLUSIVE crisis, then we have spleen sequestration crisis, and aplastic crisis. Then hemolytic crisis is where there is extensive hemolysis of red blood cells. This severe hemolysis leads to low oxygen carrying capacity because these red blood cells are dying. They're being broken down. They're being broken down before they even mature enough to do their work, and so they are dying. And so this patient doesn't have enough red blood cells in the body, and this will lead to oxygen tension, and so the patient is going to have a crisis. The second crisis is known as thromboembolic crisis, which is also known as vaso-occlusive crisis. We've already discussed that the structure of HBS tends to increase the viscosity of blood. The blood will become very thick. Once this blood is too thick, there is going to be thrombosis, which is formation of clots in blood vessels, especially the smaller blood vessels. There's going to be thrombosis, and this is going to lead to blood vessel obstruction. Now, once the blood vessels are obstructed, there is going to be low oxygen tension. There's going to be low oxygen being carried to the distal area of that blood vessel. And this results in a crisis because those areas that are distal to that place are not receiving blood. And so you find that the patient will end up going into a crisis. Now, if this is not controlled or it happens, if it happens frequently, you find the patient is going to have ulcer formations, and you find that the patient may go into a stroke if the blood vessels involved are taking blood to any portion of the brain. And then we have spleen sequestration crisis. This is where large amounts of blood are trapped in the spleen. The spleen can trap a lot of blood because some of the blood vessels will be occluded. Okay, blood vessels that are supposed to take blood out of the spleen will be occluded, and so you find that a lot of blood is going to be trapped in the blood. This causes a collapse in circulation, and so there isn't enough oxygen carrying capacity in the bloodstream, and so this patient will go into a crisis. This is a life-threatening crisis because large amounts of blood will be in the spleen. The fourth crisis is a plastic crisis where the bone marrow is unable to produce enough red blood cells. The result is low oxygen tension, and so you find that sometimes this one will occur as a result of infection or as a result of drugs that may suppress the bone marrow. And so you find that the red blood cells are not produced according to the amount that they're supposed to be produced in. So they are inadequate in this case. And so the oxygen carrying capacity is reduced. This patient will therefore go into a crisis. Now, what are the predisposing factors to a sickle cell crisis? We said that anything that will result in low oxygen carrying capacity is going to result in the patient going into a crisis. So the first one that we'll talk about is dehydration. Dehydration leads to blood viscosity, which results in failure of the blood moving in the way that it should move. Therefore, the patient is going to go into a crisis. The second one is infection, especially those infections that destroy red blood cells or the infections that will affect the bone marrow's production of red blood cells. And so you find that the patient goes into a crisis. Strenuous exercises that require the body to have enough oxygen. So you find that this patient starts doing very strenuous exercises. Therefore, the organs in the body will need more oxygen. The muscles will need more oxygen. And so because of that, you'll find that this patient is going to go into a crisis. Severe trauma where the patient may end up bleeding, okay, or where the patient is going to end up with breakdown of a lot of blood vessels or red blood cells. So you find that this trauma is going to result in the patient going to a crisis. Then exposure to cold. Patients who are exposed to cold may end up having remember there's some organs where blood will be shunted from, because when it is too cold, the extremities, blood will be shunted away from the extremities and from so that it does not reach there. This will lead to a crisis because this will further cause in a patient who has HBS, the HBS will crumple the red blood cells, and so the patient is going to have severe pain. Changes in altitude from low to high, where there is going to be low oxygen concentration, will also result in a sickle cell crisis. Those are the crises of sickle cell. Now, let us look at the signs and symptoms. Signs and symptoms include attacks of abdominal pain. This is due to ischemia of the abdominal tissues, the abdominal viscera. And the patient is going to have bone pain due to bone ischemia, and breathlessness will be there due to cardiopulmonary involvement. So you find that there isn't the blood is not enough. If the blood is not enough, red blood cells are not enough. And so you find that the patient is going to be struggling to provide oxygen to all body parts, and therefore they are going to try and breathe in as much as possible. Patients who are sicklers have a delayed growth and delayed puberty because energy demands of the bone marrow for red blood cell production will compete with the demands of the growing body. Patient will be fatigued due to tissue hypoxia. Patient will have fever due to inflammation. Remember, the body is fighting these abnormal red blood cells, and so there is generalized inflammation, and so the patient is going to have fever. The patient is going to have jaundice due to increased levels of bilirubin. When there is hemolysis, there is release of bilirubin, which is a byproduct of red blood cell breakdown. And because this bilirubin is high, it is going to overwhelm the liver, and the liver is not going to conjugate all of it. And so you find that the patient is going to have yellowish skin and mucous membrane. The patient will present with pallor due to low HB because a lot of the red blood cells are being hemolyzed. Patient will have a rapid heart rate because the heart is trying to compensate in order to provide oxygen to all body parts, all body organs. Patient is going to be susceptible to infections. This is due to low immunity, especially in aplastic anemia, where the bone marrow is unable to produce all three blood cells. And so you find that the patient is going to have a reduced number of white blood cells as well. And so the immunity is going to drop. The patient will have ulcers on the legs, okay? And this is due to tissue ischemia because the blood is not going there as it is supposed to be, and these wounds may end up taking even longer to heal because blood is not there to provide nutrients for healing. The patient will have blood in urine due to renal damage. Now, this is due to repeated tissue infarction. The patient will have pain, chest pain due to pulmonary infarction or cardiac ischemia. The patient will be restless, especially during a crisis, and this is as a result of pain. And then in male patients, you find that they are going to have very painful erection that will be severe. This painful erection is not voluntary. And so you find that the patient will be in erection for a long time and it is going to be very painful. This is known as priapism, and it occurs in 10 to 40% of men with sickle cell disease. Now, this is due to blood being trapped in the blood vessels of the penis. Patient will have poor eyesight or further blindness due to impaired blood supply to the retina, and the patient will have cyanosis. All right, you look at their fingernails, a patient will be cyanosed, and this is due to hypoxia. The diagnosis of sickle cell disease, you do a full blood count. It will show an HB that is low and reduced red blood cell count. You do a Sickling test, which will be positive. Hemoglobin electrophoresis will confirm the diagnosis. History will show that the patient has sickle cell in the family, and the clinical features of sickle cell may be present. For example, anemia. A patient will have pallor. Patient will be jaundiced, and so you will notice there will be also growth retardation, and so you will notice those clinical features. For treatment, you want to give the patient, first of all, antibiotics for prophylaxis against any superimposed infections, such as cristapen penicillin. You are going to give oxygen therapy for hypoxia so that the patient has supplemental oxygen. You have to give very strong analgesics such as pethidine. Narcotic analgesics such as pethidine should be given depending on the age of the patient. You can give pethidine, and the pethidine can be administered either IV or IM. And this will depend on how the crisis is on the pain levels of the patient at that particular time. You can give folic acid also in order to allow for formation of red blood cells, and you give blood transfusion with packed cells, okay? And then you can give non-steroid anti-inflammatory drugs, because remember, this patient is in generalized inflammation as the body is trying to fight off these sickled cells. And so you give non-steroid anti-inflammatory drugs such as aspirin, all right? And then you give IV fluids such as normal saline, and this is going to relieve dehydration. And remember, the blood is viscous at this point. And so you're going to also give to reduce the number of the episodes, you can give hydroxyurea, all right? Now, sickle cell is a very serious condition, and so it was going to give you very serious complications. Patient may go into cardiomyopathies because of a number of reasons. First of all, the blood is too viscous, and so the heart tries to fight as much as possible to push this blood to reach all the parts of the body. And so you find that the patient may develop cardiomyopathies such as cardiomegaly, okay? Even cardiomyopathies such as coronary artery disease, because those small blood vessels that are taking blood to the myocardium may be infected, and so you find that there will be coronary artery disease. Patient will end up having renal failure. This is as a result of reduced blood supply to the kidneys. Patient will end up having retinopathy due to infection in the blood vessels that are taking blood to the eyes. Patient may end up having retardation, growth retardation in children because of the increased energy demands. Patient may end up having stroke or brain injury and splenomegaly, because remember, the spleen is involved in breakdown of these red blood cells. And then other complications include priapism in males. Okay, we've already discussed what priapism is. Patient may end up having gallstones because of increased hemolysis of red blood cells and production of these red blood cell breakdown products. The stroke, the patient will have leg ulcers, these leg ulcers which may be difficult to heal because of reduced blood supply to the legs. Okay, so here's the nursing care. Please go through the nursing care and make sure you understand it very well. Until we meet next time with another condition, have a good day.